Hello dear students, I Cəlilov V start our third lecture about epidemiology of the respiratory disease and epidemiology of the fecal oral infectious disease. And our lecture was designed for students of the faculties of general medicine and dentistry. Plan of our lecture consists of two parts. The first part we will talk about the respiratory infectious disease, and second part of the some epidemiological features about the gastrointestinal tract infectious disease. What is the respiratory disease? And when we talk about the respiratory disease, we said that this group of infectious disease are characteristics by the high level distribution. And what's the cause of this distribution? Why this group of infectious disease occur arise as a common problems amongst the peoples? The first times I want to note that our vulnerable respiratory apparatus is easily invaded by microorganisms, and it is clear that the breathing is a continuous process, and as respiratory gases are wafted in and out, and infecting organisms find free passage deep inside our body. The site of the entry is commonly the nasopharynx, but entry can also occur through the oropharynx and the conjunctiva. According to the localization of the microorganisms, there are two groups of the respiratory tract infections: the acute respiratory tract infections and the upper respiratory tract infections and the lower respiratory tract infections. And result of the upper respiratory tract infections arise as tonsillitis, pharyngitis, laryngitis, sinusitis, otitis media, common cold, and lower respiratory tract infections arise as the bronchitis and the pneumonia. Then respiratory infections are usually transmitted by the direct contact among between individuals, and generally the closer the contact, the greater the chance of spreads. As contact between human beings is a necessary part of life, and contact becomes more difficult and non-specific. Even so, the respiratory disease are an enigma. The voluminous quantity of expelled organisms are sufficient to infect the entire population. Yet only some individuals manifest this disease. Three basic features which characteristics for the respiratory tract infection. The first, the injuring of the respiratory mucous membranes. Second is the airborne transfer mechanisms. And which infectious diseases are concerned in here? For example, the acute respiratory infections, measles, whooping cough, chickenpox, mumps epidemic, streptococcus, meningococcus infections, tuberculosis, leprosy, and so on. And I want to say about the transfer mechanisms, airborne mechanisms, and the importance of these mechanisms in the distribution of the respiratory tract infections. These transmission mechanisms occur by three stages. The first stage, the microorganisms go out from the infected organisms by the exhale, talking, sneezing, coughing. And second stage, the microorganisms remain on the environment, and there are the different aerosol form of the microorganisms in this stage. And third stage, the microorganisms which stay on the environment passes the new susceptible organisms by the breathing. And etiological agents of the respiratory disease are divided three groups depend on the resistance impact of the environmental factors. Weak resistance microorganisms, average resistance microorganisms, and resistance microorganisms. Which resistance microorganisms stays alive for a few minutes and until a few hours on the environment. For example, the microorganisms of the measles, fly, some acute respiratory disease, coronaviruses, varicella, German measles, pertussis, meningococcus, and so on. Average resistance microorganisms can to stay alive for a few hours until a few days. For example, the diphthery, golden staphylococcus, group A staphylococcus. And resistance microorganisms can to stay alive for a few days until a few months. For example, the nasal smallpox, the tuberculosis, and so on. And how these microorganisms to live on their own environment, and what does it depend of the resistance of these microorganisms? Why we said that some group of the microorganisms can to live on the environment within a long time, but the other group of the microorganisms only stay alive for the few minutes. It is depend of the aerosol forms which these microorganisms formed on the environment. For example, the weak resistance microorganisms form on the drip aerosol form on the environment. When drip aerosol damage on the environment, these microorganisms damage too. Which group of the microorganisms can to keep on the environment as a drip aerosol and the nucleus aerosol form? These microorganisms can to live on the environment within a few hours until a few days. And for example, as a diphthery and staphylococcus, golden staphylococcus, and so on. Which group of the microorganisms can to form as a drip aerosol, nucleus aerosol, and the reduced aerosol form on the environment? These agents can to stay alive for a few months, until a few months. And this microorganisms is the resistance microorganisms of the respiratory infectious disease. And distribution of the microorganisms, distribution of the respiratory infectious disease is depend on the resistance microorganisms. An epidemic process. epidemic process of the respiratory infections are characteristics for some indicator. For example, source of the infections of the respiratory tract infectious disease is the ill persons or the carrier persons, and transfer mechanism is the airborne mechanisms, and airborne mechanisms occur as the airdrop, air nucleus, and air-induced way, and susceptible peoples of the respiratory tract infectious disease uh, are the more cases are the children's and adults who has more than 60 years old. And factors which affect the course of the epidemiological process of the respiratory tract infectious disease. There are different factors which impact the continuance of the epidemic process. For example, the contagiousness of the pathogens, contagiousness of the microorganisms, and some social factors as the age group of the population, the migration of the population, and density of the population, and so on. And second, very important data for the respiratory tract infections. And depend on the vaccination work, there are two groups of the respiratory tract infections. The first group is a controlled infectious disease. The second group is an uncontrolled infectious disease. If there is some medical immunobiological preparation as a symptom, as a vaccines against the infectious disease, we said that this group of infectious disease are the controlled infectious disease. But if there are not any medical immunobiological preparation as a vaccines against the infectious disease, we said that it is an uncontrolled infectious disease. For example, some example about the controlled disease: diphthery, measles, pertussis, tuberculosis, diphthery, and so on. For example, about the uncontrolled disease. Uncontrolled disease, coronaviruses, acute respiratory infections, and influenza, and so on. Structure of the epidemiological surveillance systems of the respiratory tract infections, respiratory infectious disease. And surveillance systems consist of three group of the measures. First, gathering analytic information. Second, the diagnostic measures. The third of the administration measures. What's the analytic information? It is the monitoring of the mortality and the morbidity rate of the disease to find out the carrier form of the disease. And diagnostic, epidemiological diagnostic measures is done in two forms: the retrospective and the operative. And what's the aims of the epidemiological analysis? Aims of the epidemiological analysis to study of the regularities developing of the epidemic process. We found epidemiological risk factors and quantitative evaluation of the causes and the epidemic and effect relationships. Administration measures is the assessing of the quality of preventive and anti-epidemic measures. And analytic information consists of analysis, spreading, and features of the circulated microbial strain, analysis situation of the immunostructure of the people, analysis effectivity preventive and anti-epidemic measures, and analyzes information about the social demographic process of the population. And first respiratory infection of our lecture is diphthery. What is a diphthery? Diphthery is an acute respiratory infectious disease which usually affecting the mucous membranes of nose and throat. But in advanced stage, diphthery can damage the heart, kidneys, and nervous systems of our organisms. What is the etiological agents of the diphthery? The etiological agents of the diphthery is the Corynebacterium diphthery, and there are three biological variants of the diphthery: Corynebacterium diphthery, gravis, mitis, and intermedius. Only the toxic strains are involved in the formation of the disease. Symptoms of this disease are the thick gray membrane covering throat tonsils, a sore throat and hoarseness, swollen glands, difficulty in breathing or rapid breathing, nasal discharge, and fever and chills. And causes airborne droplets, contaminated personal items, and contaminated household items. It is the transfer factors of the, there are the, these are the transfer factors of the diphthery. Classification of the diphthery, there are some form of the diphthery according to the localization, the diphthery of the nasopharynx, diphthery of the nose, and combined forms, and the diphthery of the rare form of the diphthery. For example, the diphthery of the eyes, diphthery of the ear, diphthery of the skin, diphthery of the genital tract. And infection, source of this infectious disease, the ill persons and the carrier persons. And immunity of this infectious disease are two: post-infective immunity and post-vaccinal immunity. And post-vaccinal immunity is the antitoxic, but the post-infective immunity are two: antimicrobial and antitoxic. And there are not shown the seasonality and the periodicity of the diphthery, and apparent form of the epidemic process is sporadic, and risk group of the people and are the persons that had not been vaccinated. And bacteriological examination is more important for the controlled diphthery, and bacteriological examination is done three proposed: the diagnostic bacteriological examination, epidemiological, and preventive. The diagnostic epidemiological bacteriological examination is done amongst ill persons who has the diphtherial duct. For example, the ill persons with the angina, infectious mononucleosis, tonsillitis, and laryngotracheitis. And epidemiological bacteriological examination is done amongst the persons who come into the contact with the patients, with the infected people. And preventive bacteriological examination is done amongst the children's home, amongst the children and the different medical establishment for the tuberculosis and the psychoneurological disease. Planned vaccination against the diphtheria is done 5 times after the born first 2 months, 3 months, 4 months, 18 months, and 6 years old of the children. Measles. Measles is an acute infectious disease too, and this infectious disease are characterized with a general intoxication, fever, inflammation of the upper respiratory tract, and for example, the mucous membrane of the nose, throat, eyes, and large blood rush and pneumatic complication. Measles is known since the ancient time. The first time the English physician, which name is Sydenham, determined the clinic of measles in the 17th century. And etiological factors of the measles is the rhinovirus, which involves the paramyxoviridae family and morbillovirus kind. And these microorganisms are not durable against the influence of the environmental factors. That's why these microorganisms can to stay alive until the 20 or the 30 minutes on the environment. The symptoms of the measles, some symptoms of the measles is a fever, non-productive cough, runny nose, sore throat, conjunctivitis, and red skin rash. And some symptoms, some the differentiation of the amongst the ordinary measles, between the ordinary measles and German measles. And there are some specific symptoms which help us to do the differentiation both of two diseases, the ordinary measles and German measles. For example, the cochlear spots on the buccal mucosa is characteristic symptoms for the ordinary measles. But the lymphadenopathy is a characteristic symptoms for the German measles. For example, the rash begin at the higher line and spread all the body in the ordinary measles. But the rash begin on the face and passes all our body in the German measles. It is the symptoms which help us to do the differentiation this group of the respiratory infectious disease. And measles, infections source of the measles is the ill persons, and infected period of the ill persons, the last day of incubation period, last days of the incubation period, prodromal period, and from formation rash until 5th day, and 5th days rushing. And incubation period of the measles continues until the 21 days. Transfer mechanisms of the measles is the airborne mechanisms and vertical mechanisms, and immunity of the peoples occur as a post-infective immunity and post-vaccinal immunity. And type of the disease, apparent form of the epidemic process is sporadic and the epidemic, and risk group of the people is the persons who had not been vaccinated. And seasonal things are characteristic for this infectious disease, and level of this infectious disease arise increase in the spring and summer season. Influenza is very famous respiratory tract infectious disease. And this infectious disease, there are 6 pandemics in the 20th century. 6 pandemics of influenza has noted in the 20th century. And there are 3 serological group of the influenza, and etiological factors of the etiological agents of the influenza is the RNA virus, and this which involves the Orthomyxoviridae family and influenza virus kind. Infected people are the source of the infection in the influenza, and infected period of the ill persons after a few hours the formation first signs of the disease until the first days. There are 2 forms of the immunity: post-infective immunity and post-vaccinal immunity, and seasonality and periodicity are characteristic for the influenza, and influenza increase in the autumn-winter seasons, and periodicity of the influenza arises every 1-2 years, and risk group of the people are the children. And second part of our lecture, epidemiology of the gastrointestinal tract infections. In other words, we can name this infectious group as the fecal-oral disease. Fecal-oral disease. And fecal-oral group of disease are transmitted by person to person, the contact, through water, food, or directly to the mouth. When we talk about the etiological agents of the respiratory tract infectious disease, we said that the distribution of the respiratory tract infections depend on the resistance of the microorganisms. And there are the 3 groups of the microorganisms. We said the resistance, weak resistance, and so on. But the microorganisms, the etiological agents of the fecal-oral group of disease, all microorganisms of the fecal-oral group of the disease are the resistance for against the impact of the environmental factors. And these microorganisms can be transmitted by person to person, contact through waters, food, or directly into the mouth. That's why when we talk about the gastrointestinal tract infectious disease, we can group this infectious disease as a fecal-oral infectious disease, or the food-borne infectious disease, waterborne infectious disease, and so on. And this depend on the reservoirs of the infections. And what is the typical situation which help distribution of this infectious disease? For example, the proper water supply, rubbish and dirty surrounding, and abundance of flies. And how can we control this group of the infections? For example, breaking the fecal-oral cycle with personal hygiene, increase in the water quantity, improvement in water quality, food hygiene, the provision of sanitation, the disposal of garbage, and the control of flies are also important for controlling of the fecal-oral infectious disease. And one of the interesting side of this group infectious disease is the symptoms. Many of the infectious diseases of this group are characteristics by the diarrhea. That's why some literature we can see the name of this group infectious disease as the diarrheal disease. According to the presentation of the diarrhea, there are three groups of the disease. This first group is the acute watery diarrhea, infectious disease which arise as the acute watery diarrhea. For example, salmonellosis, food poisoning, bacterial gastroenteritis, viral gastroenteritis, cryptosporidosis, cholera, and so on. And second group, the infectious disease which arise as the acute diarrhea with blood. For example, the bacillar dysentery, shigellosis, campylobacter, and so on. And third is the chronic diarrheal disease, giardiasis, for example, the giardiasis intestinalis, and chronic disease with blood. Some infectious disease arise as a chronic diarrhea, blood diarrhea. For example, the amoebiasis and palantidiasis, schistosomiasis, and so on. And I want to note that there are if we see the statistical data of the diarrheal disease, we can to see that the level of the deaths per year from the diarrheal disease significantly decreased within the last 30 years. But it is true that today 1.5 million people die every year from the diarrheal disease. And depend on the data from UNICEF, then 17% of the infectious disease occur by the diarrheal disease, as the diarrheal disease. And many different pathogens cause infection of the gastrointestinal tract. Some of these are found in amongst the humans and the animals. For example, the Escherichia salmonella, for example, Campylobacter, and Clostridium perfringens, and Yersinia enterocolitica are found in both humans and the animals. And this very interesting slides. This slide shows a clinical period of the all fecal oral disease. And some microorganisms which located in the gastrointestinal tract are causes of the other systems. of the injuring of the other systems. For example, the surgical infections. Escherichia coli is one of the etiological factor of the surgical infections in the 17% cases. And some information about the epidemic process. Fecal-oral mechanisms are characteristic for gastrointestinal tract infections, and fecal-oral transfer mechanisms occurs by hepatitis 3 stage. The first stage, the microorganism is going out from the infected peoples by the defecation act, and second stage, the microorganisms demand an environment, and this stage is different and different in this different infectious disease. And third stage, the activators is entering into new susceptible organisms. And anti-epidemic measures against fecal oral disease is done 5 directs: isolation of the ill persons, neutralizing of the transfer factors, to take out the carrier from works in meal and water establishment, sanitary educated work, and specific preventive measures. And first, fecal oral infectious disease of our lecture is the typhoid fever. Typhoid fever. What's a typhoid fever? Typhoid fever is named as a typhoid abdominalis and enteric fever too. And it is an acute infectious disease that occurs with cell intoxication, bacteremia, and injuring lymph nodes of small intestine, intoxication shock, intestinal perforation, and intestinal bleeding. And etiological agents of this infectious disease is the Salmonella typhi. The first time this activator has been discovered by the Ebert in 1880 years. And Salmonella typhi is very resistant against influence of the environmental factors. That's why these microorganisms can't live in waters or land for a few months. Infection source of the typhoid fever is the ill persons or the carrier persons. Transfer mechanisms is fecal-oral. Way of transfer is the alimentary path. Factor of the transfer are food, water, milk, and other alimentary factors. This slide shows us the first common vaccination amongst the children in the Texas in the 1943 years. The first developing vaccines was discovered by the Almost Edward, and it is a distribution of the typhoid fever on the worldwide, and some information about the symptoms of the typhoid fever. According to the clinical period of the typhoid fevers, the clinical period are divided to 4 times: the first week, second week, the third week, and fourth week. The typhoid fever incubation period is take in 7 to 25 days, and after incubation period occur intoxication symptoms. And the first week occurs a temperature fever until the 38 Celsius degrees, and bradycardia, malaise, headache, cough, and some changing of the blood indicator, for example, leukopenia, eosinopenia, relative lymphocytosis, and so on. And to the diagnostics, we can do the diagnosis by the blood culture method within the first week, but the without test is negative in the first week. The second week occurs a specific symptoms of the fourth fever. For example, temperature increase until the 40 Celsius degrees, and occurs a delirium, and delirium is frequent, and this delirium gives to fourth fever nickname of the nervous fever. And other specific symptoms for the fourth fever is the rose spots appear on the lower chest and abdomen in around a third of patients. There are diarrhea occurs in the sixth time or the 8 times also on the day, and after the second week, without test and blood culture test is positive. Third week. What occurs in the third week? Third week occurs the intestinal hemorrhagic process. For example, the bleeding in the congested pyle patches and intestinal perforation in the distal ileum, and encephalitis, neuropsychiatric symptoms, metastatic abscesses, and high fevers. After the third weeks, some patients died or some people recovered. Second infectious disease for our lecture is the shigellosis. Shigellosis is an acute gastrointestinal infectious disease which happened with intoxication sickness and injured large intestine. And etiological agent of this infectious disease is a Shigella. Shigella is a genus of gram-negative, facultative anaerobic, non-spore-forming, non-motile, rod-shaped bacteria. And there are 4 serogroups of the Shigella. Shigella dysentery, Shigella flexneri, Shigella bodi, and Shigella zone. And Shigella zone often spread by food, Shigella flexneri spread by waters, Shigella dysentery spreads by some inanimate object of the environment. A change of intestines happens in 4 stages after the infected shigellosis: the catarrhal inflammation, fibrous necrotic, wound, and recovering. This is a pathogenic period of the shigellosis. And symptoms: incubation period is take 1-7 days. After the incubation period, begin with high fever, headache, weakness, intoxication. Ill person feel discomfort in abdominal part. After this discomfort, begin diarrhea. Egg diarrhea. Egg happen at intervals and increase when occurs a defecation. 25-30 defecation occur per day. When we do palpation, we feel the air of the large intestine is hard and is painful. And one of the specific symptoms of the shigellosis is the mouth dries. Mouth dries in ill persons within the clinical period. Diagnosis: dehydration with fast heart rate and low blood pressure, abdominal tendencies, stool culture, and wild blood cells in stools. Treatment is done against the two directs, the etiological treatment and treatment against the dehydration. For etiological treatment, we use some antibiotics, levomycin, phtolazole, floxam, interferons, some aminoglycosides, neomycin, kanamycin, gentamicin. And treatment against the dehydration is used by helps of some solution as a 1.9% sodium chloride solution, Ringer solution, and so on. And third, escherichiosis. Escherichiosis is one of the common causes of the diarrheal disease. These infectious diseases are named as the coli-infectious or the blood diarrhea. Coli-infectious is created by different serotype, colibacteria, and result it is formed gastroenteritis, gastroenterocolitis signs. And the first time the etiological factor of the disease is discovered by the Austrian scientist Escherichia, who named the Escherichia in 1886 years. And Escherichia coli is a genus of gram-negative, facultative anaerobe, non-spore-forming, non-capsid-forming Rorschach bacteria. And there are three antigens of the Escherichia coli. They have somatic O, thermolabile H, and somatic Q antigen. Pathogen Escherichiosis is divided for group: enterotoxigenic Escherichia coli, enteropathogenic Escherichia coli, and enteroinvasive Escherichia coli, and enterohemorrhagic Escherichia coli. Enteropathogen Escherichia coli occur as enteritis in jejunum among children until 1 year old. Enteroinvasive Escherichia coli is cause of injury at the colon among the adult and children over 1 year. And this form of the Escherichia coli created as the illness unlike the dysentery. Enterotoxin Escherichia coli. Enterotoxin Escherichia coli arises as a disease which unlike the cholera. That's why the cause of this infectious disease, the cause of the clinical symptoms of this infectious disease is the enterotoxin, thermolabile and thermostable enterotoxin. And these enterotoxins create the dehydration, unlike the cholera, amongst the children and adults. And last form of the Escherichia coli is the enterohemorrhagic Escherichia coli. As this group of the microorganisms create the colic amongst the adults and the children. And symptoms of the Escherichia coli, for example, invasive Escherichia coli, fever is 38, 39 Celsius degrees, occurs in some symptoms as a headache, ache of the abdominal area, diarrhea, 312 defecation for a day, mucous blood stools, thickness, tonic, positive strength symptoms. For example, diarrhea, 15 defecation for a day, vomit, ache before diarrhea and vomit, dehydration, normal fever are characteristics for symptoms for the enterotoxogen Escherichia coli. Treatment, the etiological treatment is done by help of antibiotics, kanamycin, tetracycline, levomycin, gentamicin, and for dehydration we use some solution as glucose, 5-10% glucose, and sodium 0.9% sodium chloride solution, and so on. This is the material for our third lecture. Thank you for your attention. If you have any question, send my email, please. Thank you very much. Thank you for your attention.